Kenya registered community health nurse, trained a few years ago, a couple of decades ago in Kenya, and then I worked for His Highness the Aga Khan and for Kenyatta National Hospital before I relocated to the UK, where I started my nursing journey in the National Health Service in Scotland and moved to Reading. I currently work for Reading Berkshire Hospital. I'm one of the lead nurses in network care medicine. I am the founder and the president for Kenya's Nurses and Midwives Association, known as KENMA. We are on the website, you can look up for us. And we came together particularly during the COVID season because we felt that we needed a safe space where we could share experiences. But because of the COVID restrictions, we were not able to do it a face-to-face launch. So we ended up doing it as a virtual launch, and I do give thank you to all our partners that joined us during the launch, and some of them are represented here today. We have been working closely with the Kenyan government and the Kenya High Commission and the Department of Health and Social Services here in the UK to try and support the recently signed MOU for the healthcare workforce between the Kenya and UK. We're also working in partnership with the UK Healthcare Alliance MOU, which was signed earlier on in the year.
The associations are very important because that is what we are trying to help people understand, that before you come to this country, this is what you need. We are trying to prepare you to be in that environment. When you come to the United Kingdom, you're ready and you're having that kind of a softer landing.
We are in the NHS here. They have given us a platform whereby we can be able to express ourselves. The confidence that we have 20 years on is not the same confidence that we had when we came in 20 years ago. So for me, I would actually say UK gave us a platform whereby, apart from the confidence here, it's confidence that we bring it back home as well in our own communities.
The association mandate is going to be expanded, and you are going to be more involved bodies to make sure that when they come here, they are able to discharge their responsibilities in the spirit of a Shujaa or a Kenyan. We must make sure that the nurses who come from Kenya, our ambassadors, let us create a reputation that Kenyan nurses are the best in the world.
Actually, so it's great to be here today at your launch. We've been doing a lot of work at NHS England and Improvement and with the Florence Nightingale Foundation to put additional support into the nursing associations, of which there are many now. And what I'm really loving seeing is the fact that we've got such a powerful voice of nurses internationally coming through those associations. So, and we're also, and it's great to see some of the other leads from some of the other associations here today. We've got them collaborating, working collaboratively together, so strengthening that speaking with voice. But I did want to just start by saying congratulations to you on forming the association. It's really important, particularly as we're going to see more Kenyan nurses and midwives come to the UK. So actually making sure that support from even before they start in the UK and helping them in that transition is going to be really important.
And just to hear what Duncan had to say, and to hear the content of the fact that they're suddenly recognising and realising how important and how vital each and every one of us from the diaspora, every single one, wherever we come from whatever part of the world we come from, we're vitally important, because nurses are just phenomenal. As you said, it's not a career, it's a vocation, it's a part of our lives. Somebody mentioned that they could not look after people, they're just different. But my passion is for humanity. It doesn't matter whether you come from Kenya or England or Africa, whatever part of Africa or the West Indies you come from, or you're born in England, we're all human beings. And as I said to somebody earlier, we're all spiritual beings having a human experience. We are a spirit, we have a soul, and we live in a body. The body just happens to have different colours on the outside. And because some of us are black, and some of us are brown, and some of us are darker, and some of us are lighter, there's so much ism and schisms and stuff going on. But we need to forget all that, because today we could be gone, and that's the end of the story. But each and every one of us is here for a vital purpose.
There is 18 organizations like ours, nursing associations from other countries that have got internationally recruited nurses in this country. So this tells you that we are doing the right thing at the right time. So if we find something that we would like to voice, and we are glad that the Nursing and Midwifery Council in UK and NHSI and NHS England are listening to what we are saying, then we come together, because when we speak together, we are a louder voice and people get to listen to us. For example, things about health inequalities, things about cases, or maybe things that maybe some of our nurses are experiencing when they've come from abroad, things about recruitment and retention, and all the other bits of health inequalities that people will be aware of.
That we have been reliant on international recruitment since the inception of the NHS. It's all to do with being able to recognize the contribution of ethnic minorities. And it is so overwhelming in terms of that purpose of gathering their collective voice and making sure that representation is there, that you have a seat on the table, but at the same time that you are heard. And that is the road to equity. I think it's a very momentous time within the National Health Service to have this.
Nurses and midwives that have come to work in the UK in the last few years from overseas. That's incredible, huge numbers. And each one of those people will have made such a big difference to people's lives. The simplest thing that everyone from the UK needs to say to everyone who's come to work in the UK from overseas is thank you. Thank you for the work that you've done, the amazing contribution that you've made to our health service.
For those people that are coming into the UK, the cultural integration is key, is a challenge. And it takes time to settle that. Individual challenges as well, especially for those that do not have anyone in the UK. And it's going to be very, very isolating. And I shall be mentioning that. And many of them do not have support networks.
I'm from Diaspora Insurance, like I mentioned. We're just going to talk about the importance of insurance, especially in our diaspora community. I think people have been sharing experiences of people coming from Africa to here, and how they feel lonely, and sometimes they feel isolated, the challenges that they face. And one of the key features is that we need insurance products to make sure that if anything happens to us, we're secured.
And because many people are desperate to come over to the West, there are shortcuts. So what we would advise people to do is try and stick with the reputable recruitment agencies, or if they're coming to the NHS, they stick with the NHS recruitment processes. But what we're finding is that a lot of nurses and midwives are coming over on their own back. They're not waiting for the normal structures. They are just desperate to get here, and some of those individuals will fall prey to some of those unscrupulous people. So I think, and remember that a lot of our nurses and midwives are in the NHS, a lot are outside of the NHS, not just an NHS issue. So I think that's where we can work with the unions and with NHS England and the diaspora organisations. We have like a triple-pronged approach. So wherever the nurses and midwives are within the system or within their country, they've got points of contact where they can find the right information for them.